Big shifts are coming that could reshape how Social Security, taxes, and healthcare work for millions of Americans, especially seniors who depend on these programs to secure their financial and medical well-being. The Senate has introduced and passed key changes in a bill closely linked to former President Trump's policy agenda, and understanding exactly what this means for you is more critical now than ever. These aren't abstract political promises. These are real, concrete adjustments that could affect your monthly Social Security checks, tax obligations, and healthcare coverage starting soon. If you're receiving Social Security benefits, whether retirement, disability SSDI, or supplemental security income SSI, this new bill includes provisions that could alter your payments, either by increasing them, adjusting eligibility rules, or impacting how they interact with other income sources. On the tax front, many seniors might see changes in deductions, credits, or income brackets that directly influence how much money stays in your pocket at the end of the year. And healthcare changes embedded in the bill could affect Medicare premiums, out-of-pocket costs, and access to certain treatments or services, making it essential to stay informed to avoid unexpected expenses. What makes this update so important is that it's not just a one-time tweak, but part of a broader shift in policy designed to address long-standing issues affecting seniors' financial security. Rising healthcare costs, inflation pressures, and evolving tax laws have made it increasingly difficult for retirees to maintain stability, and this bill aims to provide solutions. But the details matter, and misinformation is already spreading. That's why it's vital to get clear, accurate, and up-to-date information from trusted sources, starting right here. In this video, we'll break down the most important elements of the Senate's new bill, explain how the changes will impact your Social Security benefits, taxes, and healthcare coverage, and provide practical advice on what steps you should take now. Whether you're planning your budget, managing medical expenses, or just trying to understand your future benefits, this guide will give you the tools to stay ahead of the curve and protect your financial well-being. As we explore the new Senate bill connected to former President Trump's policy framework, it's essential to grasp the full scope of what these changes mean for seniors who rely on Social Security, face evolving tax laws, and depend on healthcare programs like Medicare. At first glance, bills like this can seem overwhelming because they touch on many areas of life that impact your day-to-day finances and well-being. But when you break it down into understandable terms, it becomes clear that these adjustments are designed to address very real challenges faced by retirees and disabled Americans. Starting with Social Security, this bill introduces modifications aimed at increasing the benefits for many seniors, but not without certain eligibility revisions that could affect some beneficiaries. The core idea is to strengthen the financial security of retirees by providing a boost to monthly payments and adjusting the way cost of living increases are calculated. This means that if you are currently receiving Social Security, you may see your checks rise at a slightly higher rate than usual, which is welcome news given the rising costs of everyday essentials. However, these increases come with new rules that might change how your other sources of income or assets are considered when determining your benefits. One aspect that often causes confusion is how Social Security benefits interact with other income sources, such as pensions, investments, or earnings from part-time work. The new bill attempts to clarify and tighten these interactions to ensure fairness and program sustainability. For example, it could adjust income thresholds that determine whether your benefits are taxable or how much you can earn before your Social Security payments are reduced. For many seniors, this means paying close attention to how your overall financial picture aligns with these updated rules to avoid surprises during tax season or in your monthly budget. Tax changes in this bill are particularly significant because they directly affect how much money you keep after the government takes its share. Seniors have long benefited from certain deductions and credits designed to reduce their tax burden, but this new legislation reevaluates those provisions. Some tax breaks may be expanded to offer greater relief, while others could be phased out or restructured. For instance, the standard deduction might increase for older taxpayers, or new credits could be introduced that reward caregiving or medical expenses. On the flip side, some income brackets could shift, which might change your marginal tax rate. Understanding these tax changes is crucial, especially if you rely heavily on fixed income or have multiple streams of earnings. Many seniors are also concerned about how these adjustments will affect retirement accounts like IRAs and 401ks, and whether required minimum distributions RMDs will see new rules. It's a complex area that deserves careful review with a tax professional, but having an overview of what to expect helps you plan and avoid unexpected liabilities. Healthcare remains one of the most pressing issues for seniors, and this bill does not overlook it. Several provisions aim to reduce out-of-pocket costs for Medicare beneficiaries, improve access to certain medications, and expand coverage for preventive services. These changes are designed to address some of the financial strain caused by medical expenses, which have been rising steadily and often faster than inflation. Lower premiums, caps on drug prices, or new subsidies for low-income seniors could provide meaningful relief, but the details will matter when it comes to implementation. At the same time, the bill includes measures that may tighten eligibility or adjust benefit levels for certain healthcare programs, so it's important to stay informed. Changes to how Medicare Advantage plans are regulated, adjustments in copayment structures, or revisions to supplemental insurance options could affect your coverage choices and costs. For seniors navigating these options, understanding the fine print can make a big difference in both healthcare quality and expenses. It's also worth noting that veterans and their families, who often receive benefits that overlap with Social Security and Medicare, should closely follow how these legislative changes affect their specific situation. Coordination between VA benefits and federal programs is complex, and adjustments in one area might influence eligibility or benefit amounts in another. Engaging with your local VA office or veteran service organizations can provide personalized guidance to ensure you maximize available resources. One of the best ways to approach these upcoming changes is through proactive planning and education. If you haven't reviewed your Social Security, tax, and healthcare situation recently, now is the perfect time. Gathering all your financial documents, understanding your current benefit levels, and consulting with trusted advisors can help you anticipate how the new rules will apply to you. This way, you can make informed decisions about spending, saving, or even working part-time without jeopardizing your benefits. Moreover, the government agencies responsible for administering these programs will be rolling out detailed guidance and updates in the months ahead. Paying close attention to official communications and attending community informational sessions can help you stay ahead of the curve. Many nonprofits and senior advocacy groups also provide free or low-cost workshops to help beneficiaries understand changes and navigate paperwork. While it's natural to feel uncertain about changes to long-standing programs, it's important to recognize that this bill represents a step forward in addressing the financial and healthcare challenges facing America's seniors. The rising cost of living, longer life expectancies, and evolving healthcare needs require policies that adapt to today's realities. By adjusting Social Security benefits, tax codes, and healthcare programs, lawmakers are aiming to create a more sustainable and equitable system for current and future retirees. Still, no law is perfect, and some provisions may spark debate or require adjustments as they are implemented. Keeping informed and engaged in discussions about senior benefits is critical. Advocacy and feedback from beneficiaries help shape how policies evolve and ensure that programs meet the needs of those who depend on them most. For seniors watching this video, the key takeaway is to be prepared and proactive. Changes to Social Security, taxes, and healthcare affect your financial and physical well-being, so understanding what's coming enables you to take control. Whether it means adjusting your budget, seeking additional benefits, or simply staying alert to new deadlines and rules, the effort you put into understanding these changes will pay off. If you have questions or concerns, don't hesitate to reach out to trusted sources, whether it's the Social Security Administration, IRS, Medicare offices, or veteran service organizations. These agencies exist to help you navigate these complexities and ensure you receive the support you deserve. Remember, this isn't just political talk. It's your money, your health, and your future. Staying informed, asking the right questions, And making thoughtful decisions now will help you weather these changes with confidence and security.